think about healthcare, you might first think about the expensive acute care that we read about in the headlines. But if you ask family physicians, they'll tell you that 90% of your healthcare is in the community. But really, who provides almost all of your healthcare? It's not doctors, it's not nurses or other healthcare providers like me. It's you. Real healthcare is self-care. The best predictor of your future health are the habits you practice today. So the 4 foundations of good self-care are what you eat, what you do, how you feel, and how you relate. What do you put into your body, those healthy and unhealthy things? What do you do with your body? Physical activity that supports all the activities of daily living and helps you do what's meaningful for you. How do you relate to other people? How do you connect at home, work, and school, and with society? And finally, how do you feel? How do you recognize your emotions and how do you manage them? And how do you live a meaningful life? The doctors who compose the divisions of family practice care for our patients in our practices, care for you individually, but now care for our community as a whole. And we're involved in other stakeholders in providing the best healthcare that you can have and to make you the best self-care provider. Let's talk about the complete physical exam. Some people used to think that the physical should be a routine thing, that every adult over 20 or 30 should come in for a routine physical. But they did a lot of research to find that the routine physical on someone that was totally healthy with no symptoms, no family history, not at increased risk, no chronic conditions, that they found it wasn't terribly cost effective. So the routine complete physical is no longer a benefit by MSP, but many of you probably do qualify for a complete physical exam with your physician. So the rule is actually, if you have a chronic condition like congestive heart failure or have risk factors for heart disease or other conditions that we're actively treating, if you have some unexplained symptoms that are very serious, like unexplained weight loss or unresolved pain or multiple systemic problems, you probably do qualify, and that you should talk to your doctor about that. And if you're not sure, always talk to your physician about it. And of course, we do complete physicals for prenatal care, for chronic conditions such as diabetes and heart disease. So we usually start off with the general questions. But the first question is, has there been a change in your energy level? Because most people think as they get older, the energy should drop down, that our bodies have a rechargeable battery. When you're 2 years old, it charges fully overnight. When you're 50 years old, it charges about halfway. And then we can't get new batteries. That's just the way people get used to a little decline in energy. So a decline in energy that's very slow and gradual, that might be okay. But a decrease in energy could be due to depression. That's one of the major causes of physical symptoms of feeling exhausted. It could be due to then underactive thyroid. That's a gland in your throat that controls your energy level. So when the thyroid is underactive or hypothyroid, it can make you feel cold, make you gain weight, make you feel tired. It could be because you're not sleeping properly, you have insomnia. So that's very common to us at times of stress, but it also is very common as we get older too. It could be to a condition called sleep apnea, where you stop breathing during the nighttime. But you may not be aware of that because you're trying to sleep at that time and you're exhausted. But your partner might notice, and you might notice that you're totally exhausted during the day and falling asleep on the bus, falling asleep when you're a passenger in the car. And if it's really bad, you might be just falling asleep as a driver at the traffic lights. So if you have extreme exhaustion and daytime sleepiness, ask your doctor if you might have sleep apnea, what the signs would be. Or ask your partner if you stop breathing at nighttime. A decrease in energy could also be due to respiratory conditions, like poorly controlled asthma or chronic bronchitis. It could be due to heart failure where the heart is not pumping in its usual strong way. It could be due to some blood disorders like leukemia, lymphoma, and it could be due to cancer. Most of the time it's not due to cancer, but if you have a significant decrease in your energy and you're not keeping up with your older neighbor who's walking past you down the street, do check it out with your doctor. So an increase in energy. So most people don't complain about this, but it can be due to medical conditions. It could be due to anxiety, because people feel revved up. It could be due to mania, the opposite of depression, or hypomania when it's not full-blown mania. Most people don't come to the office when they're feeling elated and really happy and grandiose. We see them only when they're depressed. It could be due to some of your medications. A lot of the medications have sedation or sleepiness, or changes in energy, or an increase in energy as a side effect. An example would be prednisone, the steroid, tends to rev us up and make it hard to sleep, give us too much energy. It could be due to an overactive thyroid that makes us lose weight, makes us sweat a little bit more, makes us feel jittery and tremorless, and raises our energy level. Or it could be due to other hormonal conditions. So have you gained or lost a significant amount of weight? So most people think they might gradually gain weight over time, or they might not notice a few pounds. So normal weight gain might be just due to your last holiday, the Chinese New Year dinner, a big banquet or a birthday. A few pounds is okay. It could be due to excessive eating, like an eating disorder. It could be due to a decrease in your activity. If you've given up your weekly exercise, you will gradually gain weight unless you replace it. It could also be due to diabetes, where high blood sugars tend to make us put on more abdominal fat, or heart failure, where we're retaining fluid because our heart's not pumping it from different parts of our body. It could be due to kidney failure. It could be due to a lot of the medications that doctors prescribe, or an underactive thyroid as well. So weight loss could be due to anorexia, inadequate diet, depression, not absorbing your food, a parasite, drugs, medications, smoking, cancers, and overactive thyroid and other hormonal conditions. Have you had increased hunger and thirst? So that's significant as well. So the classical symptoms of uncontrolled diabetes will be increased hunger, increased thirst, increased volume of urination. So those usually indicate very high blood sugar. If you don't have those symptoms, you could still have diabetes, but that usually doesn't cause a lot of symptoms until we actually do the screening test. And then finally, how is your sleep? So your sleep could be disturbed, again, by a thyroid that's overactive, by anxiety, by mania, by pain, chronic pain, back pain or any pain elsewhere could be disturbing your sleep. You could be getting up at night frequently to urinate, and that's disturbing your sleep, or your partner might be getting up at nighttime to urinate as well. And it could be shift work that disturbs our normal sleep-wake patterns, pregnancy, and of course, anyone that's been a parent, children.